most of patients with mind disorders, they have to be treated with the gut, not only by talking, but doing some bacterial treatment and together.
Yeah.
We expect to have about 500 different bacteria inside, but we know only 80.
Wow. Can we get addicted to stress?
Yeah. Adrenaline, cortisol, they activate the fight and flight system.
Okay.
And you can get clearly addicted to this chemical reaction. If you're a body weight of 70 kilos, you will produce 70 kilos of ATP every day.
Wow.
You can't imagine how much energy your body is really producing. This is a wonder of nature. And at the end, to be honest, longevity is nothing more than prevention. And this is a large field of science which is not open.
Welcome to the Living a Life in Balance podcast. My name is Abdullah Boulad. I'm the founder and CEO of the Balance Rehab Clinic. My guest today is Dr. Simon Feldhaus, general practitioner, integrative medicine specialist, and one of Switzerland's leading voices in longevity and anti-aging. In this episode, Simon shares his personal journey leading to combine classical medicine with complementary preventative care. We explore how chronic stress, poor gut health, and over-medication have become the dominant health issues of our time, and why true healing begins not with a prescription, but with understanding how the body actually works and empowering the individual. Simon explains how he uses microbiome testing and mitochondrial support and individualized supplementation to treat the root cause of physical and mental symptoms, from anxiety to fatigue, poor sleep, and even early cognitive decline. We also dive into the science of energy production and the groundbreaking potential of therapeutic sugars like galactose in supporting brain health, especially for those dealing with Alzheimer's, diabetes, or burnout. Simon also debunks some of the biggest misconceptions around longevity and shares evidence-based steps we can all take to age with grace. I hope you will enjoy. Simon?
Hello.
What motivated you to do what you do today?
Well, it started just in early childhood. With the age of 3, I have photos where I walked around with some medical stuff things. Now it was inside of me helping people to stay healthy or to cure if they are ill. So it's my motivation is just not to treat patients. My own motivation is help patients or educate patients, however you will call that, to get in a possibility, in a state of knowledge to stay healthy or to help them at first to cure something. And sure, if there's an illness where you're not able to do it by yourself, then there comes the second part where actively has to be treated. And then my job will be to treat you. But my primary idea is not to treat patients, but to educate them, to get them in a new state of knowledge, to stay healthy and to cure them by themselves, not by giving any medications.
So you have always wanted to be a medical doctor at the age of 3.
That's
This has
exactly
never
that.
changed.
No one there was no influence from my parents. Even my father was a doctor too, but he never said something like, "I want you to do the same. You have to go after me" or something. No, nothing.
He was a
no
role
influence.
model.
But sure,
kind of.
I've seen that, and especially in his case, he did in these early years. He was one of the first one using natural medicine and acupuncture in a classical house doctor system, and I saw that there's more than the classical medicine. This was clearly influence.
Yes.
But the point of it was inside of me, not being other jobs.
You grew up in Germany and studied in Germany.
Yeah.
How was it for you to practice medicine and study medicine in Germany?
Yeah, I'm from Germany. I lived in Germany, and my whole education and the university study it was in Germany. And then I did a practicum between the study. It was in Switzerland for 4 months, and I go back and did all the doctor's examinations and everything like that. But then I would like it to start in Germany. But the point is that in this times, long time ago, but to be honest, same as today, the surroundings for thinking holistic, doing more than giving tablets or medications or whatever, was not in Germany possibility. There were some few ideas, but at the end, no. Because if you did that, no one paid for that and everything like that. No one wanted that. And in Switzerland, to this times, it was very open. And the Swiss idea is more natural because they are living in the mountains. They use the herbs from the mountains. That's why I swifted to Switzerland 1999. Started there my really working, because it was more optional for me to use all the things I want, not only classical medicine, but other parts too. That's why I swifted to Switzerland, and from this on, I'm living in Switzerland and doing my job. The development thoroughly is something like going in other ideas of Europe medicine too, that more big pharma medicine is on the topics, and all the things beside that are slightly going down from the government, not from the people. The people, they want these holistic thing, they want things from nature.
Yes.
But the government and insurances, they go down with paying. So you have to pay by yourself. That's the end.
At the end, someone has to pay for it.
That's the point. Yeah.
So directly or indirectly.
Yeah.
And that's possibly why there is always a limitation. I mean, we know the insurance costs, they increase year by year. So where is the limit, and where do the individuals need to be empowered to take care about themselves, also financially, about their health? In some countries, I can see that in the UK, in the Middle East, in the US, or any third world country, they know they need to finance for themselves.
Sure.
Or the tribe or the families, they have to collect the money to allow someone to get treatment. But I see this also very often, that in Germany, Switzerland, let's say, those developed countries with functioning insurance, everyone relies on insurances for their treatments to be paid.
Yeah.
Has this been also coherent with your experience?
Absolutely. And I think this is one is the problem, a misunderstanding of insurance. Because normally I do insurance to not use that.
Yes.
If I do insurance for my car, at the end of the year, I'm not driving a car against the wall to get the money back from the insurance. So normally insurance means I do everything to not need them.
Yeah.
But in reality, I pay every month about 400 francs. At the end, I have 5,000 francs input. So at the end of the year, I want that back. This is something like in mind, which I can understand, but presently it doesn't work. So we have to empower everyone to look at themselves.
I like the empowerment.
Yeah.
But what does it mean for an individual to be empowered?
Yeah. It's
How
the
would that look like?
understanding of staying healthy. It's the understanding that waiting for an illness is not a good idea. So, and only I'm feeling good does not mean I'm healthy. Because some of the illnesses, to be honest, most of the illnesses are developing under a stage where we don't know that, we don't feel anything, there's no pain, and we have not something like a red light or a oil pressure warning which says, oh, you have to look, because if you don't, there will be an engine cut down.
Yes.
Thoroughly, we don't have that. So we have no possibilities from ourselves just to see, am I fine, or are there any developments in my body which should be addressed before I get an illness?
What you practice, can we say it's kind of functional medicine? Can you explain to us what's your understanding of functional medicine?
So that's the same as in other parts in our society and our times. Everything has to get new names, and now it's called functional medicine. That's why I'm saying, yes, I'm doing that, but it's the same that 20 years ago, where we said that complementary, holistic, or whatever we will call that. I think that the term of functional is okay, because it focuses on the function of the systems in the body. And that means all. It means from the psychological thing, it must be working. It's from the chemical thing. It's from the physical things. So we address the body's abilities to do networking, functional things together. And this is the main part. And for me, the main topic, and this is what picks us away from the classical medicine, because classical medicine does the same. It looks like the function of your heart, of your liver, of your lung, and then we measure the function of the lung. We can measure if the heart is pressing and everything like that. But they miss the connections between these things. They just look at one. And it's okay if you have a heart disease and one of the vessels is closed. It's very important that there is a special doctor who is able to get in this very, very small vessel to open that back again, and it will functional be again clearly. But for chronic diseases and most of the things, for acute medicine, you need these specialized things. But for the most of the chronic things, it's the working together. The functional medicine means that we look together if every connection between organs, systems is on a possible optimal way. It's not ever possible to do it in every patient, and clearly not. But the idea is trying to get the connections between all these systems in the best able way to focus to address the idea of my personal life. And that means it must be individual, because your system and my system is not the same. So why should we do exactly the same things? And if we get someone who wants to live with marathons and doing sport, he has a completely other lifestyle. So it's not possible to do the same as I do. So we have to address his special functional things. And so this is what I think. It's an individual medicine which focuses on the network of the body and the connection from all systems. And I mean all in real all. From psychological things together with chemical things, together with physical things. And you have to try, and this is hard work. It's not so easy, to try to put all that together in one system. And then I can try to play with that together with the patient to get all these network things working. This is all, but it's quite difficult. And the most part, it needs experience. You can't do that after 1 year teaching.
How would you understand the body and how it works? Because everybody is different, and every patient must
Quite
be, in
easy
this case,
to stay
be
on a
treated
healthy
individually,
lifestyle. But the problem,
adapted. How do you understand the functions of a body?
yeah, that's a very, very good question. And this is exactly the most difficult part of all, to get this understanding, or let's say idea, because you are not able to prove all these things.
Yes.
We know there is a connection between gut and brain. So if someone has a psychological issue, whatever, we have to look if the gut system is connected to the brain. But the connection is not measurable. We cannot measure how much connection is there.
Yes.
But we know there are gut bacteria or something like that. So we can do some measurements, and then the point of all these things is which is the normal range. So this will be very difficult if we address that later. What is the normal values of something like that?
Yes.
And that's what I mean. This is not what you can do on a complete science-based thing. Okay, the number is 10. Your number has to be 8. Why? Perhaps my number is 8, but yours 12. And this one addressing is not only by completely cleared science. This has extremely much to do with experience. And then there comes the thing which is sorely, from my opinion, in our classical medicine system, it's lost. We call it empathy. It's the love to the patient. It's the emotional connection
Not
to
just
every
based on
patient.
numbers and
Absolutely that.
facts.
And then you have to be aware who is my opposite, my patient, my partner there.
Right.
And this is done by talking, the anamnese, the
assessments.
The assessments, and it takes time. This is not possible in 5 minutes. I can't get any idea of your system in 5 minutes. Not possible. That needs time. That needs experience, and it was, and it is. No, it is. It's a try and error system. Sometimes I do think it's okay, but after 2 weeks, no.
Yeah.
And then again, it's experience. You learn from that.
Experience and kind of creativity, like trying to connect some dots and try and error, because medicine is not a straight fact. I mean, 100 years ago, you would have, with the knowledge you have had, was different than 50 years ago or now. And in 50 years from now, again, they will think about what we do today. Oh, wow. What have they been doing? But it's funny. I look at the body as something extremely capable of healing itself. And we need just to understand where is the right balance, again, where the body is still capable to renew, to heal, whatever whatever stressors come around during our life,
Exactly.
the toxins, food, environment, etc. And when it's too much
Yeah.
for the body, and then it gets problematic.
Yeah.
But the body in the first place can clean, can heal, can restore.
Yeah. That's exactly what in older times was something like self-healing energy. And sometimes it's like esoteric, which is not. I mean, if I get a wound here and it will be closed by my body itself, this is the self-healing property. But if I have not enough zinc, it won't close. So there's then the balance in this very small element. And so it goes on. And absolutely, that's my thought too. The self-healing possibilities of any organism, animals too,
Yes.
is quite high. But thoroughly our life gets threatened of that your ability is going down because of whatever.
So functional medicine is to support the body to heal itself in an optimal way. And this is again very individualized from one to another. And the other thing you mentioned is like also the brain. So is the brain more a mental construct or a physical construct? And you also mentioned the gut-brain connection here. And how is this connected to each other?
Yeah. This is one of my personal special key questions. And it's not possible to answer that correctly because no one really knows. If you got very deep in only chemical ways, you could say you think or you have in mind something, but only this is a chemical reactions between two nervous cells connecting each other with fibers. And if the connection is good, your mind is okay. If the connection is bad, your mind is not okay. So the idea of treating that is not discussing the issues, giving you some chemicals to restore better function. So if you could try to go down to a complete chemical idea of mind, which I don't think it is, but a part of it is correctly. If the cells in the brain are not able to connect to each other, it will be very difficult to think. So energy is necessary in the brain. And it's the energy of the cell. It's called ATP, adenosine triphosphate. It's a very small molecule which every cell needs to work on a chemical way. The muscle cell, the brain cell, the immune cells, they need that. So it's all that. There's a mind, there's a soul, or however you will call all these things. And there's a chemical base, which is necessary to that. And then you put together the connections that the brain is not only there because it's connected to the body. And then we have our modern brain, the big one here. And then we have our reptile brain. It's in here in the upper part of the spinal cord, which is the crocodile part in us. And this keeps us alive. The brain here, it keeps us thinking and motivating. But this one here is where we breathe, where our blood pressure is working, something like that. And this is working under consciousness. And then we have the connections which we start to develop. In my times in university, never I could say there's a connection from here to here. I would be thrown away from the university because the only connection was from here to here. This is the big vagus nerve, this is the 10th nerve of the brain, which is connecting the brain to the gut by the movement. And now we know, this is what science did, that this nerve is possibility to get information from here to here, which if I would had said that in the examination of the university, I was thrown away because at that time it was only one connection up, down. This is the first connection, but then comes more. We know that the power of thoughts is really prominent. And this is called, which is thoroughly most of people and even doctors or therapists are doing completely wrong. This is the meaning of placebo.
Yes.
Because placebo is not giving you something to try to put you out because I give you something which is nothing inside. And placebo does, I'm healing because of my word. Placebo is the idea of I want to treat you because I want to treat you. Not I want to give money or something. In my mind, in my emotions, in my inner power, I want to help you. And that's why I say I give you this with my thought of I will help you. And this is in your mind, you get this, okay, it will work. And then don't care what is inside the pill. This is the idea of placebo. It's the real working idea of the connection between us from mind to mind.
And how I believe
How
in
you believe,
myself
because
or in my
I
healing.
convince you with my thoughts. And it's not, I try to put you out. I really want that. And then your thoughts are starting. And this is the real placebo medicine, is what is your mind doing with your ideas? And it's strongly.
I heard that because I believe in something and that, let's say, a placebo effect, we still release some chemicals which have the right effect on our body.
Yeah.
Can you tell what
this
exactly happens there?
This is exactly, I mean, the science, the placebo science is one of the interesting science overall. If everyone in the medical field would get deeper in this, we get much more better results. And the most impressive thing is the open placebo. I give you medication and you know there's nothing inside. You know there is nothing inside. But you accept that I want to treat you and you feel that it works and this will work. This is the real working issue of every medication. And then comes the chemical idea, which is not depending on your thoughts. Pain medication, there's something inside which will work if you believe that or not. But, and this is science, it's not my idea, it's science. From the whole working idea of a medication, 10% is this chemical one, 90% is you. Despite what I'm doing, if there's something inside or nothing inside. That's why the most of the chemical medications have this very, very small effect. This is medicine. But there's one big thing to issue, and this is the bad sister, and it's called nocebo.
Yes.
The opposite happens. Not I'm helping you, but I get you in danger because of what I'm saying. If I give you a medication, I said, this one is, your side effects will be, you will have this, and I will address you very directly with this. You will get these negative effects. And in placebo medicine, we have these things that someone was closed in a room where a refrigerator is for restaurants, where you put in the meat, something like that. And the door was closed and he was inside this room. And he has seen outside there's minus 18 degrees in this room.
Yes.
And the door was closed. And he has seen that inside, I'm here, minus 18 degrees. But at the end, the machine was blocked. It was 5 degrees plus in the room.
Yeah.
But the people inside, minus 18. He came out with frozen hands. They were completely frozen, which is not possible by 5 degrees. But the mind said minus 18 degrees. This is nocebo. This is the bad sister of placebo. So we shouldn't use nocebo.
Yeah.
But if we choose, that's what I mean. What is the mind? The power of our mind can do both, harmful or helping. And we should only address the positive things. And we should avoid these negative things, which thoroughly nowadays, everything goes to nocebo. The medicine-based thing is nocebo. I make you fear for everything. Completely wrong idea.
I mean, that's huge. It's like medicine cannot work. We cannot rely on that. So I don't know the percentages, what our brain may affect our body in this case, or our thoughts, not the brain. Our thoughts can affect, and that's real. It's just, how can we address that? How can we stay motivated, be positive? Is it positive talking to oneself? What can we do?
That's actually what I mean with empowerment of the people. This is what I mean with education of the people. This is what I mean to help people, human beings, animals. It's a little bit difficult with understanding, but at the end, it's nearly the same. It's to address to the people, okay, believe on your minds. Then you have to see on your chemical things. It's not only possible by thinking. If you have vitamin D deficiency, you can think whatever you want. You have this deficiency. You have to cure that. But at the end, be confident to yourself and don't rely too much on all these negative impacts which coming from, and this has to be honest, most of them is from mass media press. Because if you go to any news, I did that in Switzerland for the last 4 weeks. There was never ever any positive facts in the news TV shows. Never.
Yeah.
Only this one is dying. There's someone falling from a tree in China and he died. For this person, that's very, very bad, surely. But why should I know that in China someone is falling from a tree and died? What is the idea of putting that in the news in Switzerland? But there was nothing. Yes, in one city in Switzerland, 3 children are born and they are healthy. Not this positive thing never ever came in the news. Only this one, the weather, and we have to empower the people to positive thinking. Yeah, there will be some things, yes, but who cares? Stay on your positive thinking. And this is very difficult to help patients because the system won't. The system is going on, everything must be bad.
I think if I think about it that way, the two things we can do is to try to focus on what we can control and what not, and stay away from what we cannot control, because it will just only influence us in a negative way, potentially. And the other thing is to practice more gratitude, just to focus on what we appreciate in our life and our body, but also there is a practice I came across also many years ago, to say thank you to our body, to each part of our body. It's kind of a mindful activity training, to be grateful for who we are, that our hands are allowing us to touch, and our feet are moving us, and so on. So that's a training I think we can do, beside to be grateful for our surrounding, what we have, what we are, with whom we spend our time with.
Try to live in the here and now. And enjoy your life here. Don't think about the things 10 years ago. They are gone. Why should I fear what is in 10 years in the future? I don't know. I can change it. If there is anyone pressing a button and then or atomic bomb will explode, yes, okay, then I have to address it in 10 years. But why should I worry? And this is at short. My thing is what I say to patients: don't worry. Just all. Don't worry. Stay here. What you said, it's the same. Stay in here. But it's very difficult.
It's difficult. I mean, it's like, don't think about the pink elephant. If this is, that's your true, that's your reality, and you cannot just switch it off because someone is telling you. You have to come to their own realization. That's why where mental health treatment works. You have to work with professionals who can guide you through that process. Certainly, so chemicals and our toxins affect our psychiatric or mental state as well, as you are mentioning. And how is it affected? What's in our environment or in our chemistry, biochemistry affecting?
This is exactly the second point of functional medicine, is that to be aware there are clearly chemical, physical connections, good ones and bad ones. Bad does mean it's not you will die because of that, but it could affect your whole system, your health, whatever, mind, chemical, heart, on a negative way. So the idea is not doing too much of these bad things. And yes, we have environment medicine, which is nowadays getting more and more important. How is the environment, the natural surrounding we are living in, affecting my health, starting from toxic metals, which are inside the nutritional chain everywhere, from lead to arsenic to quicksilver to whatever. And you don't see that the food it looks fine, it tastes fine. You are not able to say or to see or to feel rice. Most of the rice food has arsenic inside. That's because of production area in Asia. But that doesn't mean you don't eat rice. That doesn't mean be aware of there are some toxic things in life. So clean the body. That's the idea. Not do nothing, but just preventional. So we have to clean some things. But to be aware, there are things from environment medicine. It's the toxic metals, it's electromagnetic fields, whatever. But again, to be sure, individualized. You can have 3 people living in the same house, eating completely the same food. one is more affected from the toxic metals, the other two nothing. So it's
Yes.
completely individualized. That's not why to say everyone is in danger because of. But it's something like, okay, be aware there could be sometimes perhaps you should do something like a cleaning thing for your body, which you do the
Yes.
same by your car,
Yes.
changing the oil. You do that. So why not staying healthy on that point? For me, the most important thing nowadays, it's the really thing with the micronutrients, vitamins, and trace elements. Because the nutrition we have, even if we try to go to biological produced food or whatever, it's extremely difficult. And in some parts, vitamin D, omega-3 acid, it's clearly impossible to fulfill the needs of the body with our idea of nutrition and system. And again, you don't feel that. This is the only possible thing, is to measure that in the blood. It's not possible by looking at you. If I can say you have any deficiency, but if the deficiency is there, things won't work. I mean, for the connection in the brain, if looking at health of mind or thoughts or whatever, the brain needs omega-3 fatty acids. This is extremely important for function. Not only the brain, but if we focus on the brain, omega-3 fatty acids are the main issues of brain function. And if your levels are down, it's not enough there. So if the car has only 1 liter of oil, but it needs 10, the engine will get a problem sometimes. So we have to fill up this oil level. And in earlier times, it was nutrition, but now we are too much people and not enough good food. Then we did the supplements. Cod liver oil was my grandparents did it. It was not so tasty, but they used that, and nowadays we can use it on other parts. So some things have to be supplemented because we are not able, with our nutritional system, because of the mass production and the huge amount of people we have to address. And this deficiency is a big point, not only in mind, but truly in mind too. But it's for heart, for blood pressure, for we have huge amount of silent inflammation, inflammational disorders, rheumatic disorders or something like that. And they need anti-inflammatory things. And this is vitamin D and omega-3. And the point is, it's not only idea, I can measure that. And if you measure that, you will find that 80% of the people around, they do not have enough of them. And so the solution is use that. Some supplementation. And yes, then that's fine. And surely I would like that everyone could be only by eating healthy, but thoroughly it is not possible nowadays in our system.
I mean, we talked about now also the gut-brain connection and also the chronic inflammations in our body. How is our microbiome affecting all this?
This is probably one of the most impressive developments in science, and it's we can say it's daily growing. The knowledge is daily growing. I don't see any field in the last 10 years where so much knowledge occurring and growing and getting new than in the field of microbiome setting. But again, we are on this level from this, to be honest. But the understanding, that's what I think is growing about the importance and the connection, the how they talk to each other, the connections from the bacteria, not only in our gut, but we are now focusing on our gut because it's the easiest way to address. We know there are microbiomes in nearly every organ. We have microbiomes in the lung. We have microbiomes in the stomach. We have microbiomes nearly everywhere. But we could address that not so good. So the easiest way now is that's why we're talking from the gut, and surely it's the most from the numbers. It's the most count of bacteria. So, and again, we call that symbiosis. We are living together. They're living inside of us, in the gut, and they're living there, and they do things for us, and so we should do things for them. So we get together in a symbiosis, and it's very easy. It's a win-win situation. So if that works, it's a really win-win situation because the bacteria are doing things which our body is not able to do. They if you talk about digestion, you eat something like a carrot or you a beef or whatever, you meat,
Yeah.
and it comes in your stomach, and there comes the acid, and it comes in your gut. And then the bacteria, they change the nutritional thing. That's why one of the most important things is perhaps we shouldn't talk too much about eating. We should talk much more about digesting. Because if my digestive system is making, I'm eating a perfectly done Demeter quality high level carrot, but my gut is completely diverse, and then we have some wrong bacteria inside, and they're making from this perfect carrot completely dust. And then it was no sense to eating this perfectly carrot if my digestive system is not doing that correctly.
Yes.
Opposite, I'm not eating the perfect carrot, but my digestive system is on a perfect level. Then it gets more out of this carrot. Then the other one get the best carrot from world, but has a low digestive system. So this is the chemical thing. They produce vitamins which are not inside the food. They're just producing that here, and they're giving us the vitamins. This is the first thing by digestive system. Then the connection from the gut bacteria, which is the to this what we know 10 years ago,
Yeah.
is the connection from gut bacteria to immune system. This is one of the major connection, and there we know, but not all details, but it's clear. Without the bacteria in the gut, there is no immune system functional in the body. We would die. So the major important thing is the connection. It's something like the bacteria in the gut, they train our immune cells how to work properly, how to do their job. It's something like in military, the young soldiers, the new white cells, they have to go to a training camp where they learn how to fight. And the trainer who does this training, this is the gut system.
Okay.
So this is important for the functional of the immune system. But now we get more and more connections. We know that they talk, cross talks. These bacteria, they talk to organs. We are not clearly sure how they do that. From the brain, we know a part, that's these nerves, the tense brain nerve, the vagus nerve, that the bacteria are able to use this cable. It's really a cable.
Yeah.
To get information from here to here, because we know that from animal where we cut down this nerve and then the connection is lost. And it goes on a deep way that there could be influencing really mind issues. So if you have a patient with a depressive disorder, mood depressive things, and you get this gut bacteria, and to put this gut bacteria in a healthy subject, he will get depressive. So you can transfer the blues, this is called. That doesn't mean that every depression is coming from the gut, doesn't mean. But it could be that in this patient, the main issue of his depressional disorder is a problem of his gut system. If you only treat this patient by behavioral therapy and mindful thinking, you won't treat them correctly because you get not the root cause in this patient. That doesn't mean in every patient. And this goes to schizophrenic disorders too. We know autism. We know that people with autism disorders, they have a completely other idea of bacteria inside. We are not sure if it's the cause or if it's another, this is new science.
Yes.
But there are things, and we get some first interesting results if we help these gut system to get in a, I don't want to say normal, because no one says what normal is. In another diversity system, let's take it like that.
Yeah.
If we help them to get a little bit more diversity in his gut, the autism changes. Or HAS, hyperactive children, something like that, they have a huge amount of wrong bacteria. If you change them, the behavior system is changing too. So we know these connections, they are extremely interesting. And we try to learn even more how we put this in a holistic concept. That doesn't mean I just give you some probiotics and you will be cured. No. But in the system and in the therapeutic field I personally think that most of patients with mind disorders, they have to be treated too, not only too with the gut, not only by very easy, not only by talking, but doing some bacterial treatment and together. Never divide things. We have to do a network together.
Yes.
And these connections, the knowledge is growing. Nearly every week there's a new study of this is connected with this, and we have new connections, and then we have that. And to be honest, and this has to be said honestly, we are starting to think, to know we know. Because we expect to have about 500 different bacteria inside, but we know only 80. There might be 400,
Wow.
which we do not know what their function, because the problem is to measure that, it's very difficult. We only can measure bacteria we know. So if there is a bacterium inside we haven't seen, we cannot measure that. We have first to detect that wherever, and then try to find out if it's in the gut too. And this is a large field of science which is not opened.
Then I think also it's about the combination of these bacteria.
Yeah.
You know, how can you say just this one bacteria is linked to a disorder, but it's a complete network possibly.
Yeah.
And then also, do you think over time and over history, the microbiome or the diversity in our today's microbiome has decreased? So could this also be the source of many disorders we see today, or autoimmune system disorders, or allergies and so on?
Absolutely. This is clear. There's no discussion about that. But, and now comes the point, how exactly, no one knows. So we are starting to get knowledge about that. And again, first you have to see it's a network. It's not only the gut bacteria, it's everything, but we know something more about the gut bacteria. We have something like good ones and bad ones, which I don't like the name, because bacteria are not bad. They're just doing some things. If there are too much of them, they are doing some things which are not so perfect for us. So it's not killing them, but getting on a balance. It's again the balance. But yes, we know that during our development of human beings, society, modernizing, we know that we can do gut analysis. So we measure the bacteria in the gut. And this is done by people in the Amazonas, which live like we think about, which was living in Stone Age time, hunters and collectors of food.
Yes.
And then we have some in South America, which are farmers. The next development, which it's not better than that. It's but modernized. And then we have modern life, America. And then we check the diversity, and we see that the diversity is lost. The people which live as hunters and collectors, they have completely other bacteria. But now comes the point, does that mean it's a bad development? No, because if you're living here or in America and you eat what we eat here, it's not the same food than the hunters and the collectors in the Amazonian forest.
Yes.
So why should our microbiome be the same than that in the forest? It could not. It has to be a development because of our nutrition. So it's not that. That's the point of normal.
Yes, maybe we don't need it anymore.
That's the point. We don't need some of these bacteria. And if you change, you're eating whatever, and then you just say, okay, now I'm changing to vegan food. And now you will eat 2 months solely vegan food. And then I do a new gut measurement.
Yes.
You will be a complete change of gut system, because you don't eat meat as a vegan. So if you don't eat meat, you don't eat animal proteins. So you don't need any bacteria in your gut which will digest animal proteins. Why? What should they be there? So they will be gone. So your gut, comparing to mine, I'm eating meat, you're not, and we compare our gut system, it won't be the same, but completely here.
So our gut can develop, can change over time,
It must.
But also if I, let's say, move from one country to another and have a different environment surrounding, but maybe also the people around me may affect it.
If you have a dog at home, your gut system will connect with the gut system of the dog. And your microbiome will be another microbiome than your colleague one house beside with no dog.
Yes.
So that this is the point of normal. If I do the analysis,
Yes.
what is normal, wrong or right? Never can say that.
Okay.
That's what I mean with connecting, and this is functional medicine at its deepest points. You cannot do it just a measurement of these bacteria, which is thoroughly done too much outside. I do a gut control. Yeah, you get the results. Okay, this is red, red, green, red, red. So only the red bacteria, they are not normal. That's wrong. You have to do. No, why? Because your lifestyle, your eating, this is normal for your lifestyle. It's red because it's not the average. But in your case, it's normal. This I have to know as a doctor who is interpreting this results.
Yes.
Very difficult. But, and then now we come to, for me, the most important point. But we know two things. The one is the real diversity, how the difference of the bacteria, and this is connected to the milieu inside the gut. Something like you want to live in a house because we have nice furniture and something like that. And if this one is okay, you will leave the house.
Yes.
So first thing is get new furniture in the house, you will stay here. So that's what we do for the bacteria. We have to get the milieu in the gut to a healthy system, and this has to be sour. That's why fermented food and everything like that, which was earlier times good, is one of the major issues. So that's the easy part. And now comes the most important part. What we do now, and this is science, we have some specialized bacteria which really have clearly, directly therapeutic effects on whatever. Immune system, inflammation, but mind too. We have bacteria where we know that if I give them to you, not my idea is not they stay in your body for the next years. I give them to you as a treatment.
Yes.
You use these bacteria, powder, they get in your gut, and now they start to interact with your gut and your brain, and these bacterium system helps you to treat your whatever anxiety, and this works very properly. Or you are very stressed, like a burnout or something like that, or children with hyperactivity systems.
Yeah.
And we use these special, we call that strains. This is a very specialized thing in bacteria, a strain. And we use these strains as a therapeutic approach. Then it's not my idea to change your gut microbiome with these strains, but using your microbiome with the strains as using your connections from the gut to the brain to help you in the treatment process of anxiety, stress, mind problems, or everything like that, together with all the other things. But as we're going in a very deep connection, and the connection from the gut to the brain is really very, very deep. For me, this is one of the major important treatment options in psychiatric medicine, to use the gut as a combination of all. And there's the science is growing every day. It's very, very interesting. I like that.
I love the idea too, in what direction this is going, because certainly much better than just suppressive medicine. So to help the body again to develop and heal itself. So that would be the goal here. And on the level of immune system, and because there are different theories about they read from allergies to Alzheimer's, where today you could read, Alzheimer is kind of also a degenerative disorder, or the body is attacking itself. And so, but also on let's say allergies, are they because of our microbiome? Where is the origin? Is it the lifestyle? Is it, well, how can we understand the immune system?
Again, a very, very, very important questions where the answer seems to be clear. No one knows. To be honest, to say every patient has to be new looked at, and you will find patients where it's nearly clear that the real cause was first the gut changement of the microbiome. Because of that, you develop the allergy. But again, you will find patients with allergy where the gut was not the first, but it's part of the game, but not the root cause. So, and the difficult, and this is again then my job at the end, trying to find out, is that the really root? So I have to address that first. Or is it something like in the development of the disease, your gut changed too? So I have to get the gut too, but not the real cause, because perhaps in your case it was aluminium or it was shock or whatever. So the difficulty is how deep is the connection from gut to. But for me personally, I've never seen in my history of being a doctor, I've never seen any patient with an immune connected disease, whatever we call that, without any gut problem. Or I'm going as deep as I say that. For me, there's no treatment of any immune disease without the gut, but not only with the gut. But never I do any treatment without. The thing with how much is the immune system integrated in course of Alzheimer's disease, this is very difficult, and this is the science is growing. There will be some influences because of inflammation. It's more like that. It's not that the immune system is directly doing things, but inflammation could be a point. And the autoimmune diseases, yes, this is quite more the thing. But again, what is autoimmune? It's losing a balance between friend and enemy. So, or own and opposite. So the main function of our immune system must be changing or seeing, okay, this cell is good, it's my one, and this cell is a bad one because it's a cancer cell or it's a bacterium or something like that. And we have to see about, okay, this is fine, I take that, or this I have to fight against. And the possibility of the immune system to get exactly between this both sides, this is a big issue. And there's a big thing which changes the way our immune system stays in the balance between fight, flight, and accept that it's harm, it's not a problem, and this one can be okay. That's why increasing allergies is going there. And the gut is connected to that. But I don't think that we have to be aware not to over-optimizing things again, and not to go too deep in things. It's connected. It's connected. I do more think that Alzheimer is dementia. Alzheimer is only one part of dementia. Alzheimer itself, for my opinion, is a clearly cell damage problem in the brain, where this overaccumulation of these proteins happens because of underproducing energy in the brain cell, and. But there are other dementia issues where completely other parts are important. So we have to be very, very individual.
When I hear all about the microbiome and the individualized care, certainly the question comes up: genetics versus epigenetics. Is genetics, our ancestors, influencing us today, or is the lifestyle of how we live and how we are exposed to nature and to others affecting us more?
Yeah, that is a very good question. To be honest, no one is able to say really he knows anything about that, because again, there's developing science. But at the end, if you look a little bit, what is nature? What is nature doing? And nature does nothing unnecessary. Everything which nature does is good. Not everything is good for human beings. No. But everything which nature does is correct. Nature does not make these mistakes. Nothing. So we have genetics. This is the thing is inside. The patients I tell, it's a written book. You have a book, there's written the text or something, a plan. You can see, okay, it stands here. This house has to be like this, with this windows and everything like this. It's written down and it's clear. And this is the genetics. And they are clearly the base of all. And perhaps 10 years ago, we thought that we are just fixed on this genetics. If they're standing, it's like here, you have red hair, you will be red-haired. There's no change. And this obviously is wrong, because we know about now the epigenetics. How is life? How is what I am doing in my life influencing the way how, let's say a little bit unscientific, the body reads the book. So we have a book, we both read that. Perhaps your understanding of the book is completely other than my understanding. So we have the same text, the same idea, but perhaps you think more in like that matter and I do think more in that matter. So the interpretation of the written text, this is the epigenetics. And this can completely change all. How deep the change can really be, this is not known now. We are getting knowledge, but if it's really possible to change all, who knows? But we know that it's really possible to change huge amount of things. We know that from twins study. We have twins which are genetically completely identical.
Right.
And then we divide them, and one is living in America and the other one in Japan. After 5 years, they are not genetically identical. They are completely genetically on the read on the book, surely yes, but they don't see like twins. They are completely other because the life and then we go to generations and it changes more. And this is why it's very easy, because exactly why that happens. If we stay in the same surrounding, yes. But if I leave the surrounding to a complete another surrounding, it would be not a good idea that I'm fixed to my genes, which are in this surrounding constructed because my family lived every time here. But human beings are the idea of moving around the whole world. And so you have to be able to change things which nature did in the idea of development of this genetical things. And because of that, we can see what are the options for human beings to be everywhere, to develop. And that's why we are not fixed to our genes. The lifestyle, the way we do, and it starts by eating behavior, stress or whatever, is affecting the way how genes are understood by the body's metabolism or something like that. And that's positive or negative. It can be both. But for me, it's more or less to be on a positive thinking way. So it's more or less, it's more important what you are living and how you are doing than what your genes are saying. That's why I'm not very fan of these genetic testing, which are always done, because we have all informations of our genetic profile. So I can do a lab control in your genetic profile and can say every gene in your body, what will be. Yes, you will be prostate cancer and you will because of your genes. But at the end, because of your lifestyle, you are not. And this is the changing point. That's why, for my opinion, we have some clear genetic things. The thing with the blood group, or some thing with the severely genetic issues for the blood or something like that. This cannot be changed by lifestyle for you, perhaps for the next generation. But most of the risk genes, let's talk more about the risk genes, they could get a risk for developing whatever. These are completely influenced by lifestyle. And this, for me, it's a positive way. If you do it on a positive way, don't care about the genes. And then we come to the thing with placebo and nocebo. For me, the gene testing is more nocebo, getting fear, getting negative influence, than placebo. I talk more about do an interesting lifestyle and then it's fine. Sometimes the genetic testing can help to get some weaknesses. And then I can help you changing the lifestyle in a special way to get rid of these weaknesses. And in this case, some testing can be okay, but I don't like the complete genetic testing, which is done now.
For me, it's beautiful. So it's not, our life is not set in stone. It's empowering. We can influence. We can influence ourselves right now, but we can also influence our next generations with how we live today and give this further. So that's pure empowerment.
Absolutely. And this is what I think it has to be used to empower the people, to help them to develop, not to get in fear of any illnesses and oh God, but just get, okay, do like that, and then this one, and this will be fine, and this is okay.
Most probably a big part of our epigenetic is the stress, the lifestyle, how is stress affecting us in today's world, how we work, how we go through life.
For me, this is one of the most important things in my daily practice. The way how people are addressed with stress is a huge amount of influence. Very short time, just as we are talking about genetics and epigenetics, one of the interesting parts of stress in here is that every cell which divides into new cells, so for development, they have to copy the genetics, and then they divide them to two new cells. And the genes are sitting on the chromosomes, which are just small books, something like that. And they are protected at the end of every chromosome. It's like an X. At the end, there are caps, and they are called telomere. This is a protecting agent so that the text in the book is safe, even if I divide that. And we know that in aging, the telomeres are shortened. And if they are gone, this cell cannot be doubled anymore. So telomere shortening is one of the major agents in aging and losing information.
Okay.
And what we know from science is that stress has a huge negative effect of development of the cutting down the telomeres. So chronic stress cuts down the telomeres, so more cells more earlier lose the protection of the gene information. This is the first part of stress. This is more or less a long-term effect of stress, or depending on when it starts.
What effect has that on our body or life?
Premature aging, premature loss of function, chronic diseases, illnesses. Dying is a little bit too much to say, but getting more problems in lower
Earlier.
ages than must be. Perhaps sometimes it's development of some diseases which could be a little bit more than without that. So but it's more loss of function.
Yeah.
So it's for me, it's a preventive thing. It's just we should try, not because of living longer, but living healthier in the same time. And we know that stress has an extremely negative effect for the shortening of the telomeres. This is the basic.
Yes.
But at the end, in the classical days, we have the idea of what is stress addressing in the body. And this has to be looked, again, much more holistic and together networking than it is outside. Because if you read newspapers or books or whatever, most in the newspapers it said, yes, stress is a psychological disorder. You just have to relax in your mind, which is absolutely correct, but it's not the whole point. We have to address that stress is a whole body thing. We have a mindful thing, but we have a chemical thing, a physical thing. And from the basic theories of stress, it's something like psychological, physical, or chemical, high influence of the body, where the body has to react to it to get back to a homeostasis, balance.
Yes.
So it's something which gets you out of your balance, mind balance, but chemical balance, physical balance, whatever. So if you go out 30 degrees temperature with a coat mantle and you overheat, this is stress for the body because of heat. And then the body has to react against heat. If you get stressed by your boss, you have to have a psychological stress. So everything is stress. But the main idea of stress in the body is coming from the Stone Age time. And this was, the lion will just now eat me. So stress in the body is a fight and flight situation.
Yes.
I have to fight or I have to go away. And that's why we have the stress organs and the stress hormones and all the things which is connected to stress. And this sets the whole body, metabolism, mind, and everything like that in the fight and flight mode. There's an animal which tries to eat me. What I have to do? I have to fight as much or I have to run away as fast as I can. And that developed by nature. And this is what we talked earlier about, the reptile part of our brain. This is not in our mind, because if there's a lion coming to chase me, if I would wait until my brain, okay, this animal, this looks like a lion, it could eat me, what should I do? No, I'm dead. So the body starts by seeing there's something developing in here, and sometimes it's a little bit experience-based, if I've seen a lion before or not. But the body itself starts directly in the fight and flight mode, meaning we have adrenaline. This is a very, very specialized hormone from the adrenal gland. This is a very small gland beside the kidney. And we have the vegetative nervous system, which goes to the fight and flight mode, and it's called the sympathetic nervous system. And all these things, we have the cortisol, which is the third one, and all these things get the body in the mode of fight, meaning muscle activity must be high, blood pressure must go up because I have to get blood in the muscles, heart function goes up, the pulse rate goes up to get even more blood through the vessels to all these organs. To get in the fight and flight mode, we need the muscles, we need the lungs. If I run away, I need the air to breathe. I need the heart power to get my blood pressure. What I do not need in a situation to fight and flight is digestive system, because I cannot say, like, stop, I have to go to the toilet when you go again. So that's why no bladder, no gut movement. So these organs will go down. The function will be cut to zero in this situation. And this is always done by the stress system, the body. This is not by our thoughts. It's just under consciousness. It's just done because of the things, and it cannot be influenced. Even if you think positive, your reptile brain goes to fight and flight mode. You can get positive influences by mind, surely, but at the end, it's a chemical point of stress. And then your body is in this situation, but normally it's about 15 minutes because you won the fight against the animal or you're dead.
Yes.
Normally, it's not about 10, 15 hours you are running away from a lion. So this system was done for a short time, and there is no problem. The problem is if this metabolism idea of fight and flight is not 15, 20 minutes, but 10 hours, 12 hours, 1 week, 3 weeks, whatever, repeating in a short time, because again, we are not thinking that there was a Stone Age man running through the jungle. There was a lion. He went away. He survived. And this next idea was, okay, where can I find the next lion? He was, okay, I've done, now I'm fine. Let's hope there's no lion. But he won't search a new lion to get the next fight within the next 5 minutes, which is our life now. The problem is not the idea of stress. The problem is the balance and the dosage of stress and the possibility how much it is, because after the stress reaction, the body goes to the rest and digest system to get new energy, to fulfill. I just fighted the lion or run away, then I'm exhausted. All my sugar levels are down because I used everything in my muscles. So I now have to regenerate, to restore new energy. I have to put out the lactic acid in the muscles, which I produced by running away. Just getting in a new idea, and this needs time. So we have a stress level, we have the restoring level, then we are on a good level. Okay, no stress, and it's fine. If this restoring part is reduced or shortened or whatever, and there comes just the next one, okay, once perhaps okay, but every time, then we lose the time for the body to regenerate, to recreate, to restore, to get back to a normal function. And this is the major problem. And that comes the point, as everywhere, it's individual. There are people, human beings, who are able to get more fight and flight in a shorter times.
More resilient.
And that is called resilience, exactly. And other ones are not. But I can see that. It's not because, yes, you are. He not or me not. You can see that. And you cannot say you are. So the most important problem for me in our times is if you are experienced and you say, yes, I have quite a resilience, I can do that. This situation for me is no stress. It's okay. You are not allowed to say that any other human being beside you has the same ability as you. And so you are not can say, no, this is no stress. What are you doing? This is no stress. No. For this person, it can be maximum stress, but yourself, you don't feel it. So it's not possible to say it for another people.
But possibly also because I get more resilient with something I'm used to do. I'm more exposed to regularly, rather than if something is novel to me.
Yeah, absolutely.
So I cannot handle. But what is scary here is, I mean, we have been made to escape a tiger maybe once in a while, and then you are in this rest and digest mode or restoring mode. But today it's chronic, and many people live it again and again every day, whether in their jobs, in their partnerships, in their whatever they do, and over years or decades or all their life. So this is certainly having effect on our health and our. Where is this? What disorders can lead this chronic stress to?
Yeah, exactly. This is the problem. Again, a balance the dosage, because And this is not depending on what I'm feeling. It's just if it's there. That's why for me the naming of positive stress is a wrong naming, because it looks like positive stress. Yeah, okay, I do it 3 times because it's positive. And that's not. Stress is a situation where the body has to fight, not really against the animal, but again. And then the point is, what I said is the organs which are not necessary for fight and flight, they are going down. Immune activation, gut, special hormones, and fertility. In the case of fighting with a lion, you don't think about making babies. So all the system which is for producing new babies is cut down. And if it's only 15 minutes, who cares? But if it's, as you said, daily, weekly, monthly, every day, then it affects all these metabolism things, organs and metabolism, which would be necessary for restoring, calming down, repairing. So inflammatory disorder, immune deficiency, it's a very easy thing. Everyone knows that cortisol is quite difficult. So if I say patients, okay, come on, you will get for the next 3 weeks, I give you a tablet with cortisol. They always say, are you silly? No, I won't take cortisol. Why? Yeah, we know cortisol makes diabetes, cortisol makes fat, cortisol is an immune depressant.
Right.
But the cortisol, the adrenal gland of the body produces, is exactly the same as the tablet. So if I have stress regularly, daily, I'm producing my cortisol tablets by myself. So I have the same effects of cortisol tablets, but produced by my body. Immune deficiency, it can be over and under. So infectious diseases or autoimmune diseases, inflammations. We have gut problems from easy things like obstipation, but to bad things, to inflammatory bowel disorders. We have hypoglycemia, much more sugar in the system. Normally, in the fight or flight situation, I will burn the sugar by my muscles because of fighting with a lion. But the normal stress is not fighting with a lion, but fighting with my job. There, I don't burn the sugar down in my muscles. So the sugar is high level in the blood. So fat accumulation, diabetes. One of the major parts of high level sugar is the sugar is going to the small cell antennas, and it's something like a creme brulee on the cell level. And so the information flow is blocked. That leads to misinformation in the body metabolism. All what we call civilization diseases, diabetes, autoimmune diseases, chronic diseases, inflammational diseases are connected to chronic stress because of the overdosage of the stress hormones, which normally are good ones, but they are not produced to be continuously working in the body, only 15, 20 minutes and then going down. And what we are doing is chronic stress. And when we seek, and we talked about that, we do stress in the evening. We go to a heavy load of sports in a sports center, and we go on these bicycles, and we do a pulse rate of 119 for 20 minutes, 10 o'clock in the evening. And then we go to bed with high level of adrenaline and cortisol because of my bicycle sports. And then I go to sleep where I do nothing, but the blood sugar level is on the fight and flight. But nothing is done with the sugar. So what does the body? The body does not, the sugar I don't need. Oh, let's do that in wherever it takes. In the stores. So this is what the chronic diseases, which we call civilizatory diseases, is most of the cases connected to stress. And some things like infertility, everything like that, which is not an illness, but a situation.
It's fascinating. We know it, but still we expose ourselves to it very, very often until we experience pain or disorder or something. But also, what's also fascinating to me is that it doesn't matter if something is real or not real. It's affecting us and our stress levels. Like, for example, if I would watch a horror movie or and people dying or reading something which affects my mood and emotions and feelings and anxiety levels. So
this is a major point. there's a direct connection between the eyes and our reptile brain and the stress system. The most important impact to get in the fight and flight mode are the eyes. Because in Stone Age time, you're wandering around the forest, and the first thing you see is there's something which hasn't to be there. The leaves are doing like that. There's some movement. I see a brown thing there. It's not, there's a line, but you see something is changing. It's not what should be there. Something like that. That's the idea. And now comes the point of nowadays. Everything which is not, it should not be here, or it should be other, or I see dead things, horror movies or whatever, which is not, which is here. Beyond our consciousness, this is the most important thing. It's not depending on, I like horror movies. Horror movies are fine. Doesn't make any sense. It's just beyond this thing. Seeing these horror things, seeing dying people or whatever it is, goes directly to fight and flight. And one of the interesting points is the number of information per second. So if it's something like, and I tell the patient the thing of my history as I was a child. There was one of the films I looked. It's called the Bee Maya. It's something like a very a child film, and it was done by hand. It was colored by hand, and you see this bee flying around and some very easy music. And this was the film I have seen, and it was slowly. But now we see something like Madagascar, computerized, in a computer generated comic movie. And the information per second is about 1 million higher than the information in earlier times of these hand-painted movies. And we give that our children at the age of 6, sitting them on the iPad, they're looking these films with incredibly number of informations per seconds in the eye of these children, beyond consciousness, generating huge amount of fight and flight mood. And this is continuing, what you said with horror, whatever. And we should never forget that the main impact are the eyes. And this is the point what you have to address in our children's system for our young generations, to help them to get aware of the problem of information connected stress. And I don't feel stressed because it's a movie, it's a comic, but at the end, in the body.
Can we get addicted to stress in a way that we seek it again and again just to feel something?
Yeah, absolutely. I mean, adrenaline and cortisol, this is, yes. That's why some of the sports activities in high level sports, they do it because of the adrenaline kick you get in this situation. Not only sports, some of these strange activities human beings are doing, which are very, very dangerous, to get this adrenaline kick. And this is in the brain. This is a chemical point. This makes really the same cells where you can address with whatever, cocaine or something like that, because all these drugs are doing nearly the same, but in a much higher level, truly, but are doing exactly the same. Adrenaline, cortisol, they activate the fight and flight system.
Right.
And you can get clearly addicted to this chemical reaction of, yes, I'm like that. And it's not like addiction like heroin or something like that, but in a wine of psychological thing, yes, absolutely. And then you search that, because without that, it's boring.
I mean, this leads to the question, what can we do on a lifestyle change, behavioral change, maybe chemical influence to avoid that, or to be in a more optimal, balanced state?
That's, for me, it's the most important point, is education. Just telling the parents for their children that you can grow up children without setting them for a comic on a tablet. They should go back to, in my childhood, we hadn't these things. We were outside in the garden, we played, we did things in the ground, we put things in nature. Education of human beings, of stress, is not only the thing you feel because of your boss or whatever. And we have to go back to this 80% of rest and digest mode every day. and we should address that. Surely everything is something like slow down your life, but it's so easy said, but no one did it. So
Yes.
it's not only slow, it's just the idea of getting in this rest and digest mode, and being honest to yourself. The most important part is to be honest to yourself, and to say, I can do that, but I do not must do that now. So okay, I do it later, because now I'm going to and the easy thing are some basics. If you sit together and eat a meal, there's no iPad, no phone, no newsletter or whatever. You sit on the table with the other ones, whoever is on the table, and you enjoy sitting with these people on the table, eat together, talk together, but never do whatever. You could do that, but it's not must. No, don't do it. These easy things has to be innovated in lives, because they are lost. If I see in hotels around, what are they doing? They're sitting together in the evening lunch, and everyone has
the
an
iPad,
iPad before.
iPhones.
They eat, no one talks.
Yeah.
For me, it's, oh my God.
Is there a percentage how much per day we should rest and digest versus being active?
From the medical, natural, physiological side, it's 80% rest and digest. This is surely in our society quite difficult.
Yeah.
So it's not, if you do that, you get ill, but the idea should be like that. And you should always think about, where can I get in these modes? And sometimes it's only 5 minutes, but 5 minutes are better than no 5 minutes. So we start with, we cannot change the thing in 24 hours, never ever. But you can start with short things, doing that, and convincing yourself it is possible. And sometimes it helps if you see how other ones are doing that. I was 2 weeks in Africa, and this was mind changing.
Yes.
Just the African vibes. They what they are doing. If you look at the women who is cleaning up the floor in the hotel, I would think, okay, in Switzerland, the same would be done in 20 minutes. Here it was 4 hours, but at the end, who cares? It was done in 4 hours perfectly. Why should it be done in 20 minutes? It works. So this was, for me, it was very, very, very impressive. I know that, but I didn't know. I don't know, but it worked.
This is
it
our
changed.
over-optimization in the Western world, probably. Yeah.
Exactly.
When I think about stress, I also think about detoxing from stress. And our lives have been kind of designed to restore that. So if we think about the day, you work all day, the night is to kind of detox or restore. And then there is also the weekends is also here to restore. Or vacations are also here to restore a little bit longer. And but then we take these stressors into our vacation. So we don't rest and digest. We still are active. We want to explore, because our brain cannot shut down and restore properly.
Yeah, this is the main thing. I mean, holidays are holidays. Surely, if you are like that, you can do whatever sports, and that's the point. But certain adrenaline kicks in holidays again. Why not just trying to get a holiday where learn to do nothing? It's quite a point, learning to do nothing. And our children didn't learn to do nothing. They are not able to do nothing. They have to do. After 5 minutes sitting there, what shall I do? And we have to learn to do nothing.
Yes, but we cannot name it. What is not doing nothing? Is there? It's what type of activity is that?
It's something that's just being here.
Being here.
But surely it's not. You cannot think about nothing. It's a red elephant or something. But learning to do, it is not. We don't not have to every time the games in your system. Sometimes it's just enjoying the nature, seeing around which beautiful nature we have here, interesting people around me, talking with the people around me, getting aware of them, who's there. I mean, again, in Africa, if you walk, the next one is, how are you? So, okay, yeah, okay. I did that in Switzerland. I just go to a street, and I said the next one, wie geht's Ihnen?
How are you?
Why are you asking me that? So just connecting to other people, just very easily with no idea, just talking. How are you?
Yeah.
Coming back to very easy things in life. This should be some of our goals for
Mhm.
everyone, for me too. I have to learn that again too, because I'm not perfect in
Yeah,
doing
we have
that.
to remind ourselves again and again about that. But a big part of the day is
Yeah,
not just work,
yeah,
hopefully. So it's also the winding down in the
yeah,
evening and the night and the
yeah,
night sleep.
yeah,
Are we getting enough sleep, and is sleep deep enough
mhm,
and restorative enough these days?
yeah. Again, this is thing from the nature. The sleep is not only done because of it makes sense, like time is gone away. It's really the idea of a sleep is of restoring the system.
Mm.
And we know even more in science, sleep was longer time not very scientific based. We are only measuring that there would be sleep. But what exactly happens during the sleeping time was not very often much science based. But now we know more. And the most thing we know, we call it lymphatic system.
Mhm.
It's not lymphatic, but lymphatic
The
system. It's
lymphatic.
from the greater here, meaning if you are sleeping, and the sleep is something like a very variety of systems. So we are not sleeping just one level. We are going in deep sleep, low level, high level,
Mhm.
low. So it's like a wave. And this very developing, stranging things in sleep.
Mhm.
This is very important. And the lymphatic system does mean if your sleep is like that, the lymphatic vessels in the brain go up and they go wide.
Mhm.
And so the cleaning, the chemical cleaning of the brain of toxic, negative substances we
Yeah.
accumulated over the day is much higher. It's just washed out by
Mhm.
your own possibilities of your own body. If you are in a good sleep mode, where you get in these phases of sleep, REM phases and everything like that,
Mhm.
because of the diameter of the lymphatic vessels in your brain.
Mhm.
So it's a clearly proven, scientific proven, measurable detoxing effect from chemical things on the brain. But
Mhm.
that only works if your sleep is not like if your sleep is like it should be, up and down, up and down. And you see that in young children. If you look at them in the night, sometimes they are just awake and then they fall asleep again. This is
Mhm.
because they are not perfectly adapted to this sleeping system.
Yeah.
And in the level of very not deep sleep, they just get surely away. And it's a good idea not to being in a room as a parent exactly in this moment, because then it's awake. And then it comes the deepest phase of sleep, and then like that, we call it the REM phase, rapid eye movement phases,
Yes.
where you see eye movements. We think that this time could be connected to dreams. Really know, we don't know because we can't ask, but we think. But it's very important to get these waves. So not like a sleeping like that. And this is the healthy sleep. The healthy sleep is extremely activity in part of the brain. The brain during sleep is extremely active. Most of the people think that the brain is something like, it's not. It's extremely active. In different cases, the detoxing way is active. But again, we are just there are things where we said during the day. There are overworked during night in the brain. That's why we dream something like that. But again, there are more cell regenerations actively, and the body is set to the rest and digest mode for the whole body. So the brain and the reptile brain gets the whole body in this restoring mode by the vagus, the parasympathetic system.
Yes.
This has to be done. And that's why we need these different phases of sleep. And that's why if your sleep is disturbed, and disturbance is not only the time of hour, how much you sleep, but especially the quality of these varieties of sleeping phases. If they are not as they should be, your sleep is not a sleep. You are not awake, that's okay. And let's say psychological, you thought, I was sleeping, it's fine. Yes, it's better than not sleeping, but
Yes.
it's not a good sleep, even if you are not awake. And that's the point. We are not able, with nothing, no medication in the world we have is a sleeping tablet. There are no sleeping tablets. We only have medications which gets you in a state of not being awake.
Yeah.
But nothing of this medication is getting you in a sleep mode. They are just cutting you down in the deepest phase it's possible, something like a narcotic state. But again, you lose these phases with these medications, and that's why the sleep doesn't do anything beside psychological. I've slept. And this is very important to get in this rhythm of sleep, to get all these things. And this is very, very difficult. And that's so difficult that we are not able to do any medication who is doing like that, beside one, melatonin. But the other ones are not able. Because to be honest, no one is really able to know how the brain does do this.
Yeah.
What we know is there are special parts of the brain which has to get the other part of the brain, our consciousness, in this state of narcotic. And this is an extremely active process for one part of the brain to get the other one in the narcotic process. So energy consumption rate of this area is high. If you are in a state of not enough cell energy, we talked about this ATP chemical agent which is produced. If you are in a state where this is not enough produced in the brain, this brain area, which helps the other area to go in a sleep state, has not enough power. And so your brain gets not in a narcotic state, in a sleep state. So you have lack of energy makes lack of sleep. Most of the people think, I'm so tired, I must sleep because I'm tired. If the part of the brain which should make sleep is tired and has not enough energy, is not awake, you won't sleep even if you are completely exhausted because of lack of energy of this. And this connection to all of this is so difficult that, to be honest, no one really knows that. That's why it's not possible. And I think it will never be possible to get any medication which gets this kind of sleep we would call healthy sleep, with these up and downs.
A natural way of the
Natural
body
way
to
of
put
sleep.
it.
And that's why we should try to do everything to help the body to get in this state by lifestyle, not doing silly things before we go to sleep, calming down before we go to bed, not doing some looking these films and everything like that. And then 5 minutes after I go to bed with the impression of whatever film did. And then thinking, yes, now I have to sleep, so now do it. Yeah, I'm ready. It's now do. I will sleep. No, sorry, not possible. We have to be aware that sleep is a wonder of medicine.
You also mentioned the ATP for
Yep.
for the brain cells.
Yep.
So how can we make sure or have enough energy source for our brain so it can regulate itself and put the other parts or each other into
this is one of the
state.
key points exactly in again, if you have a sleeping disorder, it's just not only I give you some ATP and you will sleep. Sorry, it's not so easy. But as a part of a holistic treatment, you have to address these things too. If you do not address, it's very difficult. So what we are doing is we are trying to help to get more energy in the brain. One is everything which is like fat. Because if you do high short chain sugars, carbohydrates, white bread or sweets or whatever, it makes like zit and it's gone away. If you eat something like fat, cheese or anything like that late in the evening, or eat some nuts in oil, you have the fat which is long-term giving energy. So we call that a late fat piece of meat. I don't mean a complete meal, just short thing. 2 nuts in olive oil, or if you like that, cheese, or if you like that, some pork meat with fat around. It's depending on what you like, just fat, small part. So you have some back energy for the night too. This is for normal life, and don't eat too much carbohydrates in the evening. That's the most ideal. If you have sleep disturbance, if you are still having or already having a problem, we use, it looks like silly things under you you understand that energy is a point of sleeping. We use therapeutic agents from specialized sugar, not the normal sugars, which you use in the evening before you go to sleep to get your brain enough energy for this idea. It sounds a little bit silly giving sugar, but it's not the sugar we use. It's not the sugar from apple juice or something like that, which again uses the insulin and then causes stress. It's a therapeutic sugar called galactose, which is especially for the brain, but to combine that with some fat things in the evening. And very, very old known things, which is commonly forgotten, is a natural substance called lecithin.
Mm-hmm.
It's a plant oil. Or not only plant, it's in the egg yolk, in the yellow of the egg, it's inside too. But you
Yeah.
can use that from vegetarian sources too. It's not necessary to use. But the yellow part of the egg is one of the healthiest thing nature ever has developed for any human being. And my grandparents, in that times, there was in the advertisement in the TV, use lecithin. And they all used lecithin. It was common known, but it's completely forgotten that we have a very important natural substance to help these things. So it's not so difficult, but avoid short-chained carbohydrates, fast-acting sugars.
Mm-hmm. In the evening.
In the evening.
And the eggs, would you suggest to be eaten in the evening or the
I would do both, morning and evening.
morning and evening?
Yeah.
Okay. Interesting.
But most important evening. But if you like, 2 in the morning.
Mm-hmm. So yeah, it sounds, I think, for many people strange to you need energy for the evening to get sleep.
Yeah, it's not caffeine.
Yeah.
Yeah.
Many may starve in the evening and
Yep.
go into
Yep.
which is a bad effect at the end.
Yeah. That doesn't mean if you sleep fine, you have to do that. But if you have a problem in sleeping, then you should try these things to get in another mood of how can my brain get in this completely. It's really the point that most of the people, because obviously it looks like a little bit strange, in the sleeping state, the brain, part of the brain is extremely active. It's not the sleeping state as everything is cut down. This is done by a narcotic thing. If you go to operation and they give the medication, so you go deep in narcotic issue to get the treatment. With these medications, I get you in a deep sleep area where nothing is active, because then a machine has to get your breathing, because we cut out any action in the brain. But you are sleeping, you will breathe and your pressure will go down. So these parts have to be active. So it's not possible to be in a zero state. That's why most of the brain is active during sleep.
Yes. But I also imagine that, I mean, ATP is not just for the brain, it's in every cell. So there are energy deficiencies or energy disorders as well. How do you see that, and what's common?
For me, this is one of the most developing illnesses in modern times. It's the lack of energy on cell level due to different causes, to overusing, to bad lifestyle, which causes defects of these things, to infections or whatever we are doing. We are seeing huge amount of patients, all these fatigue problems, however you will try to call these systems. We say lack of energy is not all, but without energy nothing is. So it's not everything every time, but if you have a problem of cell energy production, it will be very difficult to address other things to get on a better state. That's why the energy level production problems is a big issue, and this nature has done that. We have in every cell there's this producing agent which is called mitochondria. This is a very small part inside every cell of the human being, animals too. This is a very small thing in every cell, something like a heat oven where you put the wood in, which is the carbohydrates, the proteins, or the fat, and then it is burned. Not really fire, it's a chemical way. And the end is not heat, but the product of ATP, a chemical agent. This is the energy which is in the body, because this chemical agent can be transported to everywhere or used directly in the cell, wherever, and then it can be used as an energy cell for any chemical reaction. So this is the very easy chemical base of human beings, of life. And we need this ATP. Without the ATP, energy reactions are not possible. So
and
this has to be
restorative
produced.
functions as well, most likely in the body. So
everything you do is needing by ATP. So that is why in every cell we have this generator. It's called ATP, mitochondrium. From the biological side, this is a living bacteria. We have inside our human cell a not human thing, which is mitochondria. And we think it's a theory because no one was there for million of years. But the theory, there's no arguments anti this theory. So
Yeah.
I think it's right. It was a symbiosis of a cell and the bacteria. The cell put the bacteria in, but this didn't destroy it. And now we live together as a symbiosis
In every cell.
in every cell. So we have things inside which are not human. And to be very interesting, all the mitochondria in everybody is only coming from women. The mitochondria are only coming from women. Man doesn't do anything with mitochondria. We only give the sperm the genetical information.
Yes.
But the cell, the egg cell from the women, they are the mitochondria. So we are only giving the genetic information, and the next generation will have the mitochondria from the mother.
Okay.
So very interesting. Had something. If you think about that, it's very interesting for development of all. Who has to look big? So these mitochondria are in every cell, and they are important for this production. These are the only ones who are able to produce these ATP by using carbohydrates, fats, and proteins. And then they produce it, and then it's used for. And very easy. If I try to think, this brain cell needs ATP. Or if I'm awake, I want to do it. The part of my brain, especially the front part, which is my consciousness, where I am, this needs energy to be, yes, I'm here, let's do something. If you only have 50% of ATP molecules in this area, surely you will have a problem of getting in full power mind. If the muscle has not enough ATP, it's just a muscle problem. If the liver has not enough of ATP, she cannot produce all the hormones or detox all the things. So it's if the white blood cells, they have to move around to fight against viruses. If they don't have ATP, they are slow. So if a virus comes, it takes longer. So I have immune deficiency. Or if the police soldiers, the police in the soldier system, so they calm down my immune system. If they have a lack of energy, the other soldiers can override them. If the military police is weakened, the military can do things which it shouldn't do. So autoimmune diseases, overactive immune system is overactive because of lack of energy in the police, which would prevent overactive. So energy loss does not every time mean weakness. Energy weakness can get to overactivity of other things which should be suppressed by not being suppressed by lack of energy. So it's very, very common. You can have extremely different symptoms when you're having ATP problems, and it must not be only tiredness. So it can be stiffness in muscles. If a muscle doesn't have energy, it's not like, it's like, you know that when you are dead. After 1 hour, after 1 day you are dead, your body is stiff because of lack of energy. So muscle stiffness every time, tended muscles, you have pain in muscles, perhaps it's an energy loss of muscle. And then if you get more energy, the muscle will be smooth again.
Can we store ATP? How long is it in the body till we need to kind of refuel?
Solely we can store it for about 8-9 hours. So it's we produce the ATP we need every day, and the turnover rate of ATP producing and using per day in kilograms is the same your weight. So if your body weight of 70 kilos, you will produce 70 kilos of ATP every day.
Wow.
Kilos, and one molecule is so you can't imagine how much energy your body is really producing. This is a wonder of nature. Sorely, we have big problems in our times by not have enough of these things because of lifestyle and huge things which affect negatively these mitochondrial things.
Or if we starve, for example, or if we do this intermittent fasting, how long this should be.
This is interesting. One could think, okay, starving, then it's bad because starving makes no energy. That's correct. But the interesting thing is that's nature. Nature knows that if you are outside, you are a hunter and collector, there will be a day where you don't hunt an animal because you didn't find any. So there will be a starving day. And in the starving situation, the body goes to the rest and digest special survival mode. And this is done by special things in the body called sirtuine. These are surviving molecules in the body when the body gets in the dangerous situation. And you never know, is it only one day I don't hunt the animal, or perhaps it will be 2 days. So as soon as we go to a starving mode, nature is setting these sirtuines to a life modus. And then what is done is the possibility of the mitochondrial to produce energy is doubled. So we regenerate. Mitochondria get older too.
Yeah.
And so they have to be built new ones every day in your body. And in a starving situation, your body is producing more new, better mitochondria than before. So as soon as you get the next meal, you are able to get more energy in a shorter time to refill this lack because of the starving. That's why short starving phases are extremely important and healthy
Yes.
for our body. If you starve for 1 month, but these short things we are discussing, 1 day or the intermittent fasting or the dinner canceling or something like that, this is what we said earlier. We are constructed to have times where is no input of food, because then the body gets in these special modes.
Yeah. But then I also think about when we starve for a longer period of time or eat less than our body is need, it get access to stored energy levels.
Yeah, sure.
Where we then potentially lose weight, or what people intend to do.
Yeah, well, what then happens is it gets more efficient. So if you get a controlled starving thing, we use, surely, but the body needs resources. We cannot store ATP, but we store proteins and fat, and then we use this fat to produce the ATP, which is not coming from the food we are eating. That's why we are losing fat, we are losing proteins in the starving state. And this is why one part of the longevity community is discussing this low caloric lifestyle, where you will live about 800 calories per day and should live longer. The theory behind is thinkable because of getting in this special mode. Yeah, but discussion is what makes sense. Is it interesting? But another part we'll talk later. But the thing is, if you are starving, the body uses other parts of resources to produce the ATP. He has to produce the ATP too, but the idea where it comes from, this we use, and this we can store. We can store fat, we can store proteins, muscles, something like that, and we use now this storage for producing new ATP. We are not storing ATP, but the resources. This clearly can be stored. That's why starving makes sense.
Yes, but what then happens is we restore the ATP, the energy levels, but we potentially lack of micronutrients, nutrients, which are also needed in the body. So there are other deficiencies potentially we cannot produce automatically from our body.
This is exactly the problem. This is exactly the problem, especially when you do a repeated, long time controlled fasting. Proteins and areas, it's okay, but you need, for producing energy, these mitochondrials, these chemical ovens. It's very complex. It's a very complex process for producing these ATP and these different chemical reactions. And these chemical reactions they need. Without that, it's not possible. You have an input, protein, you have an output, ATP, between chemical reactions. These chemical reactions, they need Q10, B12, magnesium. They need these microelements. If you don't have them enough, the producing rate goes down. Whatever it does. If you have enough or not, if you don't have these elements, it's just not possible. And surely in a starving or in a fasting part, you don't eat that because the vitamin B12 has to be produced, has to be put in. It could not be produced by the body, so you have to eat that. If you don't eat it, you get in a deficiency. And if you reach that deficiency, your energy production rate will go down. So this is the problem part. When you do a complete stop of input, at the beginning it's okay, but then it's depending on how much B12 you had inside before you get in a lack, and then it will be not so good.
But that's why maybe when we think about this type of medications for weight loss or diabetes,
Yep.
the GLP-1, how this is affecting our body, starving our body,
Yep.
and the use of energy levels and the lack of
Yep.
potentially nutrients and others. How do you see the effects on our body of GLP-1?
Oh, this is a large field of
Yeah.
sadness. It's a
Mm.
very the point is, at the first point, these things work. So if I do this, I will lose weight.
Yeah.
And it's very easy because I just do that.
Yeah.
I don't have to change anything. It works. Very easy. The point is, as soon as you stop that, nothing works. Which is fair for me, but okay. So it works. But no one is really thinking about how, because it's just not losing weight. It's not, I give you something and you lose weight. Pff, that does mean your whole metabolism has to work on another state. And this makes huge changes in huge amount of things in your body, especially these GLP-1 things. They are produced, they are developed for illness.
Yeah.
And in a special situation of diabetes, this is one of the really interesting medications. But this is an illness where you have too much sugar because of. If you use it in a healthy state, you only have too much fat or whatever, but you are healthy. And now you use these substances, they have a great amount of impact in your whole metabolism, which is not normal. And this leads to huge amount of following problems, not today, but in the next weeks, because of a complete change of metabolism, which is not, your body doesn't want that. You just change a metabolism which is not there. That's why, for me, completely silly idea. I mean, in a very special state of extremely adipositas with 200 kilos and everything like that, that's another part.
Yeah.
But we are talking nowadays about women with 60 kilos trying to lose 10 more kilos like that, something like it's a lifestyle drug. So everyone takes that now. This is, for me, complete nonsense, and it's very dangerous. And we see that. We have now effects of very, very, very dangerous side effects. Losing your sight, inflammation of the nerve of the eye, immune overactivation. We will see following things.
Are these following things because of the lack of nutrients and a balanced diet as well, or just the effects of other
This is not
chemical
really clear,
processes?
as science is very low in this area. They all would like to focus on the positive effects, losing weight. Scientific ideas of what could be a side effect, let's not talk about so much. So it's no interest in this, what we see outside. I think it's a combination. There is because of lack, surely. We have great amount of problems with any fat soluble vitamins. Vitamin D, omega-3, vitamin E, vitamin A, and something like that. But there must be something like an effect of the substance itself, which is not clear what effect it is. It's a combination.
Yes, and certainly we don't have enough data and long-term experience now with effects.
I think we won't.
Yeah, but that's sometimes also human nature, that something like that is misused over.
Yeah, sure, it's easy. Why should I change anything? I just do injection and I will lose weight, and it works. The bad thing is it works.
Yes. You also mentioned this galactose.
Yeah.
How is it produced? Where is it from? And when is it right for someone like me or you to be used?
Again, this is a substance from the idea which I said earlier times. Nature does not do anything silly. Everything has its idea. So if a baby comes to the world, in the first months, normally it's fed by breast milk. Nothing more, because normally the baby is by the mother and it's fed completely by breast milk for about 6 months, sometimes longer, but about for 6 months. So if the breast milk would contain only classical sugar, and if you taste breast milk, it's very sweet because the sugar inside. Sugar is a very hard, very energy powerful thing. So if the breast milk would be the normal sugar which you use outside, the baby will die because it would be over sugar and it would be something like a diabetes.
Yeah.
That's why breast milk does not have normal sugar. In breast milk, it's galactose. The normal sugar is called glucose, something like that. galactose looks like the same, but on one part it's just the opposite. So it's nearly the same, but the major difference because of this very small change is no insulin. So if you use galactose, you eat that, or baby drinks that, comes in your body. It's a carbohydrate, it goes in the blood, it goes in the cells, and it is used for energy. But in a normal level, if you have sugar in the blood and it must go in the cell where it's burned by these mitochondrial things, the cell is something like a room in a house, and you are outside the cell before the door. And to get the sugar in the cell, you have to open the door that the sugar can go in. And the opener for the door is the insulin.
Yes.
So normally you have sugar outside, you need insulin, sugar goes inside. And if you do it the whole day, because the baby is drinking huge amount of breast milk, then the whole time insulin would be coming. That's why galactose goes through the window. It doesn't need the door. It goes through the window, which is slightly open. But to get there, it must be a higher amount of galactose outside to get in. So this is the easiest part. That's why the breast milk is high amount of sugar. And then it's fine. So this is the idea of why galactose is produced.
So we should drink now. Every one of us should drink breast milk.
Would be a good idea, but we do not have enough resources of that, and we won't steal the baby the food. That's why we do not use breast milk. In nature, it's in milk, so in normal milk from the cows, but the level is so low that because cow is not a baby. In cow milk, there's lactose and there's galactose too. But it's not usable. So we have to produce it by ourselves. So there's no natural source where you can say you eat something with galactose. We have to produce it as an agent for therapy.
Yes.
And it can be produced from milk. We get the lactose, we cut them.
From cow milk.
Yeah. But it's only the sugar. It doesn't have to do anything with proteins from the milk. So it's no connected to that.
Yeah.
But we can use plant agents too, from corn syrup or something like that. It can be produced, but thoroughly it's a quite difficult process to do that. It's not just if you do normal sugar, you can do it wherever, and you do 1 kilo of sugar for nothing. Producing galactose is a high processed thing, which costs money. It's very difficult to do that. That's why thoroughly galactose is quite expensive, and it's not the idea. It would be an interesting idea, but it's not possible. And I think that's the idea, that no one must use galactose, everyone. But for special situations, we use the galactose now. In this situation where energy is a problem, to help gaining faster the energy in the system. If I get fat, it gets energy, but it takes long time to produce the energy. As soon as I need more fast energy, continuously energy, it's easier to do that with this sugar, and that's why we use the galactose as a therapeutic sugar. So we don't use that as a classical nutrition, but we use it for therapeutic issues. Some very easy. I need in the university, I have my master, and I now have 5 days of full power examinations. Then I use the galactose exactly in these days and nothing more. If I have a chronic fatigue syndrome, exhaustion or whatever, I use the galactose for brain energy. If I have a sleep problem, I use the galactose in the evening for the night. So we are using galactose as a therapeutic agent.
But it could be the ideal source of as a sweetener if the production cost could be brought down.
Absolutely. It's a very good sweetener. There's only one very rare situation. There's a special illness, which is called galactosemia, which is very, very rare, where a body cannot use the galactose. This is the only way where you shouldn't use that.
Yes.
But it's very rare. In all the other things, it's very interesting, especially in diabetes. Because in diabetes, we have the problem that the insulin, is not opening the door correctly.
Right.
So you have over sugar in the blood. But if you think about that, you will not have enough sugar in the cell.
Enough.
So they have too much sugar outside, but not enough inside. And there is a special connection to Alzheimer. Then we see there is interesting research in universities that the brain cells of Alzheimer patients have a lack of energy because of a lack of sugar inside. That's why in some researcher areas, it's called diabetes type 3. If you give these patients these sugars, they get new energy in the brain cells. So we use that for that. And yes, it would be a good sweetener. But again, it's quite expensive. And it's very important because we have other sweeteners. And just last week, there comes new science. We have other sweeteners. We call it erythritol. And we thought it's a good one. But the new science makes us a little bit nervous. We have side effects of erythritol we didn't expect. So, yeah, galactose would be an interesting thing. But
Could be
at
interesting.
the moment, it's too expensive. We only use that for therapeutic issues.
Another big topic is longevity. And I feel there are a lot of misconceptions about and around it because what's offered out there. How do you see that big field of longevity?
Yeah, you're addressing one of my favorite topics. I'm looking over that for decades now as the president of the Anti-Aging Society in Switzerland. We are doing this for years on a scientific base. And earlier we called it anti-aging. Now it's called longevity, which I think it's okay because the concept is down. But the problem is now it's a money-making system, to be honest. Most of the things and the concepts are more focused on how I get money than on the real point. The idea is okay. The idea is, okay, we all get old. Yes. And if you get old, you will face some problems of the old human being because degeneration of joints, misfunction of the heart, of the lungs, and everything like that. This is because of olding of cells and so loss of function. And so the idea everywhere was, okay, let's live longer because normally it's 80, 90 years and then it's done. So why shouldn't we live 120 years? And this is in the times of pharaohs in Egypt, they tried to use substances like camel milk or whatever, or some very, very interesting things with virgins to get older. So it's a topic of human beings. But the point is, what we have to address really is it really the idea? So now I'm 80, I have my oldest problem, my joints are old. Is it really idea now living 40 years younger in this state of 80? Because I will get more
of what
problems
I have now.
than now. Is it really a good idea? And if I ask my patients, do you have the idea of getting 120 by lying in bed, sitting around a wheelchair? No. So the question is, do we really want live longer times, or do we better have a better quality in life by getting old? And we call that the best years. That's the years perhaps between 40 and 60 or 70 where the body is in a good function, not the perfect function as 20, but in a very good function. You can do a huge amount of things. And if we could do this from 40 to 100 and then we die in 2 weeks, I think everyone would say, yes, I go with. So the primary concept would be trying to enlarge the time of the best years where you can do what you want, you can be productive, working or not working, whatever you decide, but you are in a good state. And then the not preventable part of really getting old, where your cells are not able to think, doing as short as possible, and then don't have the problem of lying in bed and can do nothing and everything like that. This would be the primary concept of anti-aging longevity. Nowadays, it's more or less the concepts are going just, we do something and so you will be 120. If it's like 40 years, 80, or if no one cares, it's just 120. And then there are some of these guys you feel in the internet, they show one of the most shown is now doing it. They are only eating 800 calories a day, or 800.
Yeah.
If you look at him, you nearly can see him beside a tree because it's like this. And someone is asking, okay, why should I live longer in this state? But it's everyone has to do it by himself. So the concepts are more just live longer. They are not focusing on quality. They are not focusing on what can I do in the times I'm living longer or something like that. So for my side of view and the science, which I can overview for about 20 years now, these are not really concepts which address the thing of better life quality, doing what really is possible, and then it's end as fast as possible by not suffering. But just 10 years more. Despite what you are doing, just to have 10 years more on the planet. I do think that this is not the correct development. I do think we should more address every human being. It's an individual thing. What is your goal? What do you want? How are you? What's your feeling? And at the end, to be honest, longevity is nothing more than prevention.
Yes.
It's very easy. It's just we prevent things which shouldn't be, but we cannot stop things which are there, because when your joint is 100 years old, your joint cannot be in a state of 20 years. It's just not possible, because the joint is used. It's like a car. But we should try, as a preventional thing, to prevent people for the unnecessary suffering of oldness. For me, this is the idea of longevity.
Yeah.
And it could be something like for the social system too. So if we get the people healthier and not being in need of nursery care or hospital care in the older years, it would be better for paying these things. Because if we all get 120, but the last 10 years everyone has to be in a nursery, it's just not manageable. So it's for me, it's a must to get the quality of life and the prevention of unnecessary illnesses. For me, this is longevity.
So there is no magic pill,
No.
not for now at least.
No.
And we are not in the singularity where we symbiose with machines, where we can then live forever. So
Okay.
it comes back to
Yeah.
really lifestyle and prevention, medicine, and a steady improvement of medicine and understanding. It's not about taking 100 supplements a day and think they will help in that combination. We're much more complex.
Exactly that. And we have some knowledge. We talked about the sirtuins, these regenerative substances of the body, of regenerational things. Yes, we can optimize things.
Yeah.
So, but again, it's more the prevention of unnecessary suffering of oldness. But there's absolutely no key. It's there are in these centers, you have to go to colored boxes, you have to go to coldness cabins like that. It's very interesting for the next 2 weeks. But looking for the next 30 years, okay. The thing with the machines, okay. That we get some cyborgs. There are developments going in that way, but everyone must decide by themselves. If it's my really idea that a part of my body is changed by a machine, for me it's clear answer, but everyone has to do his own answer. There are developments clearly where things are on the way.
Yes.
If they are really good, okay.
We will see.
We will see.
The future will bring.
Yeah.
And but medicine is improving for sure. And just be open-minded, and
Absolutely.
and work on prevention and awareness. What do you do, Simon, to stay in balance in your life?
At the end, I'm trying, and surely we are all humans. There are days where I fail. Sometimes I would like to fail, because there are some things, because I enjoy that I fail in these days. But overall, I try to live these things in my life and to show my children or my surroundings, trying to live in this field of balance, avoiding fast-acting sugars. This is for me the first point. Basic supplementation. Vitamin D and omega-3, for me, everyone has to use that. If you don't believe, measure it in your blood, and then you see what's necessary. It's very easy. I don't use vitamin pills every time, but vitamin D, omega-3, something like that. Sometimes I measure that to see if I need more or whatever. Trying to be more integrated in nature, just receiving the wonder of nature, getting back to walking around, seeing this butterfly and saying, oh my God, nature is wonderful. Just a little bit, being a little bit more down, not so I'm the best and human beings are over all the nature, just being in the surrounding nature, trying to see what's that. And then the main point is that what we discussed, getting in a rest and digest mode as often as possible, as deep as possible,
Mhm.
And this is where you fail. And then you clear, okay, I failed, but now I'm getting better. And then it's
Mhm.
something like that. It's not so difficult. And it is, and this is again, it's a mind thing. It's movement. We have to walk. We have to do our perfect would be 30 kilometers per day, which is okay. So if we would get 10 kilometers per day by moving,
Walking.
this
Mhm.
would be okay. This is the thing which is my point I have to address more. The walking movement and everything like that. But it's not so complicated. It's just but getting a little bit more in the field of the surrounding nature and accepting that as a wonder of thing, and we are part of that. We are part of the nature. We are connected to there. We shouldn't destroy nature. We should go there, and we should try everything not to get in this fast developing state we all are. And this is by trying to help my children for the future to be a little bit prepared from that. I try to let them read books, not only to have these tablets like that. And for me, it's just being satisfied with what I am. It's not just
Content.
I need more. I need this. I am. Okay, I'm fine. I'm here. I'm here. I have a family. It's fine. So being satisfied, being content. I'm here. It's okay, and not thinking about there must be more. It's just okay. It's fine, and enjoying the life, enjoying social contacts, enjoying other human beings, discussing with them, talking with them, losing time by connecting people and not doing too much things. Something like that. So it's something like eat half, walk double, enjoy life, and love your nature.
Beautiful. Thank you very much. I wish you all your goals to be achieved
Thank you.
in everyday's life. I enjoyed our conversation a lot. I learned a lot, and I also think the listeners to today's episode as well. Thank you very much for coming,
Was a
and
pleasure.
yeah, thank you.